How can we truly support those who are caring for aging parents, we're balancing our careers, and raising children? Today's guest is on the front lines of these challenges and has dedicated her career to finding innovative solutions. Dr. Tina Sadarangani, an assistant professor at NYU, is not only a board-certified adult and geriatric nurse practitioner, but also a tech innovator and an NIH-funded scientist. Her work is driven by deep passion for social determinants of health and advocating for health equity. Beyond her impressive academic achievements, Dr. Tina knows firsthand the struggles of caregiving, and she is a part of the sandwich generation balancing the care of her aging parents while raising young children. In this episode, we'll explore Dr. Tina's contributions to the field of aging and caregiving, including her award-winning mobile app, CareMobi, designed to enhance communication for families caring for loved ones, particularly those living with dementia. She also shares her insights on the systematic challenges caregivers face and how we can navigate the complexities of our healthcare system more effectively. With her unique blend of clinical expertise, research experience, and personal caregiving, Dr. Tina offers a wealth of knowledge that promises to inspire and empower you. Join us as we dive into this conversation that touches on the heart of caregiving, balancing love, responsibility, and innovation. Here is my interview with Dr. Tina. Dr. Tina, we are finally here. It's been such a long time coming, but I've admired your work. I'm just honored to visit with you today. So thank you for joining me.
Thank you for having me. I have to say the feeling is mutual. It's a big fangirl club over here. I so am in awe of the work that you guys do and just the voice you have and you know the way you connect with caregivers because all of us the struggle is real and
It's
we're
so
all
real.
soldiers. So really appreciate all that you do and thanks for having me. I'm so honored to be here.
Thank you. It's so true. And we were just saying, with our mutual friends, connections, we have to be there to support each other, right? Because you were just saying what it's an unsexy and fun topic, but it needs our attention. So yeah, here we are.
And we need a village. So thank you for being part of my village. And I
Right.
always say, do not attempt caregiving alone. Um,
Right.
and so I'm really happy. And I know I'm sure all your listeners are and all, the people who follow you are to have this resource and to have you in their pocket because you never, you need so much support to do this. It's not
Yeah.
meant to be done alone.
Oh my gosh, I know. Yeah, coming together, sharing our stories, supporting each other. So likewise.
Village.
Boy, it's a village, the community. I am so curious. I know a little bit about your background, but for everyone listening today, I would love to have you share more about you, your background. Like, how did you decide to even focus on aging and now caregiving? I'm just cannot wait to hear about this.
Yeah, I always joke. I feel like I should be lying in a therapist's office at this point to tell the story. But of course, my love for caregiving for older adults, for older patients, comes really from my own family, and I'll sort of start there. I
Mhm.
I was fortunate. I have two parents who were physicians, both doctors. And while they were working long and hard hours, they had managed to have three kids. And everyone's like, how did they have three kids? My mother was a solo practice obstetrician gynecologist who would
Wow.
have to leave in the middle of the night to go do a delivery. And my friends always ask me, how did your mother do it? And the answer is I had two amazing grandmothers, both my
Mhm.
mother's mother and my father's mother, who lived with me growing up. And they are remarkable human beings. Both are still with us. They are
Wow.
super agers. That's what we call them in our
Yeah.
business. One is 102 and a shining star.
Oh
The
my
other one will
gosh.
celebrate her 100th birthday next year. And
Wow.
as I was growing up, the one thing you have to know is that sometimes when you have physician parents, they tell you and they warn you in advance to never go into medicine or healthcare because the healthcare system's
Mm.
so broken, they don't want any of their kids dealing with what they're dealing with. So for years, we were dissuaded from entering any of this in this field. And as I got to college, I was actually an anthropology major, but very interested in health policy. And in my last year, I took a course on death and dying because it was like the cool class that you had to wait
Right.
till your last year to get into. And one of the things I realized was that people in this country are living longer, but they
Mhm.
are not living better.
Mm,
Not something we talked about at home or something that was really something that my parents brought up with us or ever shared with me. Um, and I learned that a lot of the people who make healthcare policy and healthcare decisions in this country have absolutely no idea what it is like to care for someone, whether it's a
mm,
doctor, what doctors or physicians or nurses go through, or what families go through. So that really led me to this career of wanting to do something in the healthcare field that could really improve the care, particularly for older adults. I want everyone to super age like my grandmothers do.
mhm.
And so I spend a lot of time trying to study what the secrets are to
What are the secrets?
what are the secrets? We can definitely touch on that. I'll tell you the
Oh
secrets
my
are
God.
resilience, positivity, and a lot good genetics and a lot of
Yeah.
healthy lifestyle factors. But
Mm,
so I will say that that sort of led me to this path. And one of the things that I did was actually I worked for a hospital, a community hospital, and one of my colleagues' tasks was to go into communities and identify health problems and build solutions to them. And she herself
mm,
was a nurse. So I said to myself, that's exactly what I want to do. I don't want to just
mm,
identify problems because we could do that all day. I'm sure we will a little bit on this
mm.
podcast.
Yeah,
But
totally.
also, it's about innovation and solution finding. And so I decided to pursue a degree in nursing, and I became a adult and geriatric nurse practitioner focused on the primary care of older adults because I really believe that at any age or stage in your life, you can make meaningful changes that impact and improve your function and your cognition. Too often we write people off. Oh, no, it's an age thing. Oh, no, you're too old for this. And I didn't believe that. And I saw it with my own grandparents, and I see just the tremendous potential that we can have on
Mhm.
impacts as people age. So I was one of those who sat at the table and told you all the things that you should be doing as if it was so easy. Like,
Right.
follow this diet, take your medications, go see that doctor, call me if this happens. And I would often, as someone who works in geriatrics, work with families. That's so like
Mhm.
essential to what we do, because we need families to implement the care plan. Well, I will tell you that I have a number of degrees. I went back, I did a PhD, I did, doctoral work in this field, grants from the National Institutes of Health. And it was not until I don't think I learned anything from any of those degrees and board
Mm,
certifications until my own father became ill. And so my father has been battling with end stage kidney disease for a number of
mm,
years now. And it was only in understanding what we needed to do to get him the healthcare he needed, to get him seen when we needed, to get him on the right set of medications, to handle the days where he's just was feeling so terrible. So many of these illnesses come with ups and downs and good days and bad days. And how do we manage them? And when to send him to the emergency room, when to call the doctor, what medications to give him when. And it was so much to keep track of. It was only in that moment that I realized how much we as a healthcare system, as healthcare providers, expect of family caregivers. And
mhm.
so I would say my most relevant credential is having this lived experience of caring for my father and fighting to advocate and get him the care that he needs. And my mother and I would always say to each other, how do people who aren't physicians, who aren't nurses, who aren't clinicians manage this? How do
Right.
they do this? It is exhausting for us. I have a PhD essentially in aging and long-term care. It is
Mhm.
hard for me. So
Right.
I don't know how people who know nothing about this field get the care they so need. And so that has really become my mission over the last couple of
Mhm.
years to work with people like you to help family members and caregivers help the people they love get optimal,
Mhm.
not usual care.
Right.
The care that you need is not the care that I need. The care that my dad needs may not be the care that your family needs. We have to be able to identify, we are the eyes and ears. We identify the needs and we have to be able to advocate to get them met. I wish our healthcare system was better set up, but
Mhm.
I am here to really make this fragile backbone of our healthcare system, which is caregivers, the
Yeah.
strong foundation of our
Mhm.
healthcare system.
Oh my gosh. I feel like I've just attended the best pep talk ever.
Let's
For
see if
that.
it
Let's
works.
do it. Let's do it.
Let's do it.
I'm so, and I said this before, but I'm so thankful that you are using your voice and identifying what needs to happen because it is by those movements that we see change, right? By the lived experience. And I've noticed it's so true. I've had so many people come up to me and say, I never knew that I would have to like walk this road with my loved one, but also I don't know. Like, what am I doing? Help me in some way. And it's in the crisis, right? Rather than being prepared for that, or even knowing how do we get the support? How do we navigate the system? And I think that's where the challenge comes in for sure. And we also share, my grandma lived with me growing up too. So
Such a gift. And
oh my gosh, it's
only now as a sandwich generationer myself to where I have
yeah,
3 kids, but I have, my parents need my support. So it's a
yeah,
different dynamic, but I do see the value. And I realize how lucky I was growing up. And I'm sure you feel the same.
I
Parents are so special.
they really are. They really are. It's just it is a life-changing experience. And I think I didn't realize it in the moment. It was as I got a little bit older and had the right perspective. And I loved it in the moment and we had this wonderful friendship. But yeah, there's so much that you learn about yourself and your loved one and in those intimate moments for sure. Hi again. Caregiving is a beautiful yet demanding role. It's easy to put yourself last, but I've learned that taking care of myself is crucial to being the best caregiver I can be. And that's why Magic Mind has become a part of my daily routine. Magic Mind isn't just about getting through the day, it's about thriving. It's a small, simple step that I can take each morning to ensure that I have the mental clarity and calm that I need. The difference is profound. I feel more energized, more present, and more connected. It's like giving myself a moment of self care that ripples throughout the day, helping me handle the responsibilities of caregiving with grace and patience. Magic Mind helps us be the kind of caregiver that we aspire to be: focused, compassionate, resilient, and I invite you to make it a part of your caregiving toolkit. Visit magicmind.com where you will receive a 48% off your first subscription or 20% off a one-time purchase with the code of Navigating the World 20. Because when we care for ourselves, we are better equipped to care for those we love.
And I'll tell you that recently we had to have my father and mother stay with me for many months because my father had a very difficult bout. And I will tell you that for my kids, it was so important. We talk about this to watch
Mm,
how we care for them and how we support them. And, I think there's an important lesson for them, as complicated as it is for those of us in the sandwich generation. There
mhm,
is some value and,
mhm.
and growth that will happen from this.
Yeah, I love that you point that out. It's so true. You talk about, and we know, right? The healthcare system is often broken and it's not built for caregivers. We see that, we experience that. How and what are you seeing are some of those biggest challenges that we as caregivers face when we're trying to navigate the system? How do we set ourselves up for success when we are advocating for that optimal care?
Yeah.
Yeah.
Yeah. So it's really interesting how healthcare has changed. One of the things that we've seen as far as a paradigm shift is that now we are moving to this model of shared healthcare decision making. So, what does that mean?
Mm,
Many
mhm,
of us come into these visits with our doctors, and maybe we've Googled like either what we have or what our loved one's symptoms, we've already come in with some amount of information. And it's really shifted from the days where it's doctor knows best and you tell me what to do. And I
mhm,
think that is really important because that means that the system is finally acknowledging the vital and pivotal role that caregivers play.
mhm,
And we also see this in just shifts in how insurances pay for things, the length and duration of time people spend in the hospital, new models of healthcare you might hear of called hospital at home, and this desire to keep people in their communities and at home as long as possible and out of institutional settings. All
mhm,
of those things hinge on having caregivers and having somebody at home to help these individuals heal and recuperate. So yes, it is still not, we are not resourced well enough, trained enough to do that still,
mhm,
but at
mhm.
least now there's space and acknowledgement about this vital role that we play. And so, yes, we are still the fragile backbone. And yes, I want to strengthen that foundation. And I think your question is a good one. How do we do that? And what is the role that the caregiver comes in with? I created actually a social media platform called Enlightened Caregiver. So what is the enlightened caregiver who comes in ready to go?
Yeah.
And so I think that caregiver is the person who comes in ready to engage in shared decision making. So, how do you do that? Your doctor is going to listen to you, hopefully, maybe not as much as you'd like, right? The average
Mhm.
doctor's appointment in this country is 18 minutes, if you're lucky. And of that, either you or the patient gets to talk for about 5 minutes. So, in that
Wow.
5 minutes, you have to come prepared to tell your story, to set this doctor on the right fact finding mission, and then to make sure that the plan of care that you leave with, that this doctor gives you, is something you can actually implement that makes sense. Because
Mhm.
what I tell people is that 99% of healthcare happens outside the doctor's office.
Mhm.
Healthcare is what happens at home. It's picking up a medication from the pharmacy. It's if you're an older adult who goes to an adult day program. Those are all where plans of care are implemented,
Yeah.
right? So I think what we need to do as caregivers is come prepared with the information at our fingertips, with the
Mhm.
information that doctors need, that we need to work with doctors, I should say, to make better, solid decisions. And so that's really a big part of my mission. And so much of what we have to appreciate is that, as I said, if a doctor is seeing you for 18 minutes every 3 to 6 months, they have absolutely no idea what your life is like.
Right.
Right. So you have to, unfortunately, the burden is on us to paint that picture of them and
Mhm.
not just to minimize our symptoms but to say and to describe to them how a given health problem is
Mhm.
impacting our life and impacting our function. So, okay, my back hurts. Take a Tylenol. My back hurts so badly that a month ago I was playing golf every day and now I'm bedridden and I can't move.
Mhm.
There's some big difference,
Right.
right? And so when they see that something is truly impacting your quality of life, they are poised to intervene and meaningfully intervene and so that's what we're looking for. And again, there are some things where you don't want aggressive intervention, but if something is truly compromising your health and physical function or your cognition, or your family is not going to feasibly be able to take you to physical therapy 4 times a week because they have a job. What are the exercises then you can do at home? Is there a virtual option? Are there other ways to do this? So we need to be clear that the care plan works for the doctor, it works for the
Yeah.
patient, and it works for us. And we have to have the data points and be able to tell the story to advocate for what we need.
Oh, completely. We do. Okay, those numbers are alarming, right?
Yeah.
When you actually go 18 minutes. What? How? Yeah, it makes sense now why we're missing and we're lacking on the place to be able to comprehensively share, right? Or to paint the full picture. I love that you talk about that. It is really painting the full picture when we're the ones that not only are experiencing that ourselves or supporting our loved ones and understanding all that goes into all of those different factors and just the amount of mental load we carry, and part of that is the advocacy. It's so exhausting, um, for families to have to navigate. Tell us more about that. What are you seeing with families? Is that their main concern is the advocacy piece, or just not knowing how to gather that information?
Yeah, I think it's not knowing what information to gather and,
Mhm.
the load, I experienced this in my own family, and I'm sure
Mhm.
you know about this as well. Oftentimes that burden falls on one person, right?
Mhm.
Somebody has to take the role and be the quarterback of the family care team. So even if you're
Mhm.
blessed and you have 10 siblings, I've heard many stories of I have 8 sisters and brothers and they don't do anything, like
Yeah.
type of, and
There's usually the one person. Yeah.
Right. I think the frustration for a lot of caregivers is why do these doctors not talk to each other? Why is nobody talking to each other? Why am I the
Mhm.
one who is like making sense of all of this for all these different people? And that is the frustration. Healthcare is a game of telephone. And it is disturbing that when your loved one's life is on the line, that you are caught up in this game of inefficiency, of fragmentation, of having
Mhm.
to fight an insurance company, having to beg a doctor, having to take a month to get an appointment that should have been yesterday. those are the frustrations that we're dealing with, right?
Right.
There's so many barriers to getting and accessing the care that we need.
Mhm.
And so, in terms of that, one of the things that I found in my own experience was when my father's health started to decline, my mother was doing a lot of the caregiving, and she was taking this upon herself in a way, probably to try to protect us all a little bit from this burden. But eventually, over time, it got to be too much for one person to handle. It escalated into a crisis. And that's what happens pretty much in every family I know, where something has to reach a crisis point for
Mhm.
us to put the plans into place that should have been put into place months ago. It happened in my own family. It happens in most of the families I work with because there's a lot of denial, not even denial, but issues of like, I don't want to accept help as an older person. I am already losing control over certain things. I'm not going to admit that I need help and can't do this.
Mhm.
So there's a lot of frustrations, and oftentimes it escalates into a crisis situation. And then one family member is the one who has to manage all of this and get everyone on the same page and try to get this all organized. And so one thing that I learned from our own experience where I felt like, had I known this earlier, I
Mhm.
would have done this different,
Right.
right?
Right.
And so one of the things that came to my attention as my mother, who's an all truly a superhero all-star caregiver, she was keeping track of diligently of my dad's information as it started to get to be a lot and there were multiple doctors in the picture and different things. She started taking diligent notes in a notebook. And I said to her, if something happens to you tomorrow and I don't know where that notebook is, I have
Right.
no clue what medications my father's on. I don't know who his doctors are. I don't know what questions to ask them. And it made it impossible for her to share her load. And sometimes
Mhm.
it's really important to throw ideas around to people in your family, to have discussions, to have informed discussions with doctors, family members, etc. I didn't know because everything was kept with her. And
Right.
so one of the things that I've really spent the better part of the last couple of years working on is creating a tool, a completely free tool. So it's not even a plug for me to get rich
Love it.
off of this.
Yeah.
But as part of my research funded by the National Institutes of Health, I blended my research in Alzheimer's disease with my own caregiving experience and said to myself, why are we such smart people, caring people, keeping information in notebooks in my family's text chain? A cardiologist once asked me, when did your dad last see the kidney doctor? I was like, oh, I don't know. Let me go through my texts with my family to see if
Yeah.
there's like memes and joke. And then there was like this
Right.
appointment. And my father's health is so precarious. Why am I not keeping it all centralized and having that
Mhm.
information ready? Because these doctors don't talk to each other and
Right.
they need to know, what are you doing at home? Who have you been to? What have you done, et cetera.
Yeah.
So that led me to create this mobile app. It's called CareMobi. It's a completely free app backed by the National Institutes of Health. And we interviewed caregivers, adult day center staff, physicians, nurse practitioners across the country to say, what information caregivers do you have? And to doctors, what
Mhm.
information do you need to help make better decisions? And so we created this
Mhm.
really simple, super easy to use tool where you can organize and put all this information in one place so that when those doctors ask you those questions, when you only have the 5 minutes to talk, you have all the information you need. And the key thing there is that then I can take my dad to that appointment and my mom
Right.
does not have to do every single thing. I can
Mhm.
start to see and say I've noticed changes and really help advocate and brings my whole family together so that nobody is simply saying, oh no, you have to do that because you're the nurse practitioner in the family.
Right.
No, we can all do this. You can be responsible for his medications too. I'm going to go away for a few days. You're in charge. Here is the list with reminders and push notifications about the medications that he's on. Those are the types of things that we need to do because as I said at the start of this, we're not supposed to do this alone. We need a village, we need a team. And
Mhm.
a tool like CareMobi, and there's other ways to do this, engages all these other people. And it's not just my family, it's the home health aide, it's the adult day center. Nobody should be doing this alone. But those people, in order to be involved and to actually reduce your mental load that you just talked about, Nicole, you need to
Mhm.
engage them and involve them in care.
Completely. Oh my gosh, completely. This is going to be such a lifeline, such a lifeline for families as we are. I mean, like you said, I can't tell you how many notebooks I've seen and how many post-its and all of those that aren't effective or efficient, right? It's about saving the mental load, saving time, being able to come equipped with what we need to share with our physician, keeping track of all of that information. And I think too, over time and as our health progresses, we also that option to use this platform will set us up to see patterns of what we need to do, what we need to take note of. So I have a couple questions around that is, um, what should we be noticing with our families? Like, what should we be taking note of? What's important for us to like pull out of all this information that we've had collected in a place like CareMobi?
Yes. Oh my gosh. I'm so glad you asked that question. So, one thing that everybody has to know, and if you're not a geriatrician, you probably don't know this, is that when older people become sick with
Mhm.
anything, they more often than not do not present like younger people do. So, if you have, you know, a sickness, you might have a fever, you might have a cough, you might have some telltale signs that something is going on. Older people do not. And their body sort of does not, as you get older, it becomes harder and harder for your body to sort of return to homeostasis. And the way that you
Mhm.
present is not the same way that younger people do. So when we talk about care mobi, and especially if you are caring for anybody who has any kind of cognitive impairment, mild cognitive impairment, or even moderate to severe, they often cannot communicate or articulate their feelings, right? So
Right.
it's very rare that an older person's going to come to you and say, you know what, I'm not feeling well. I'm feeling a little of this and a little of that. And that's not going to happen. You might notice that they're a little dizzier than usual. Maybe they have a fall. Maybe they're just acting more confused. These are all telltale signs that an individual has potentially an infection brewing, most commonly a urinary tract infection. We see them all the time in older adults, a pneumonia. And the challenge there is that, especially if you're caring for somebody who has cognitive impairment, how do you distinguish between what's like, oh, dad has his shoes on backwards because his dementia is progressing, or dad, does dad have a urinary tract infection because his shoes
Right.
are backwards? Like those are actual symptoms that people report to us all the time that I've noticed a change. And so one thing to keep in mind is this a sudden change?
Mhm.
And this is the key factor. If your dad was dancing in a conga line the other day at his senior center, and then the next day he doesn't even know where he is or what's going on, or he's not getting out of bed, or he's walking funny, those are all telltale signs that there's something potentially more serious going on. And I want to say to every caregiver who is listening, there is
Mhm.
nothing, no symptom you should be embarrassed to share, or no symptom you should feel like is too little to warrant a phone call. For with older people, yes, you get to know them. And again, caregivers, you are the eyes and ears. You know what this person is better than anybody on a day-to-day basis.
Mhm.
So you know what's normal for them and what's not. And that is so much of the role of the caregiver, to help us parse out what's normal and what's not.
Right.
But
Right.
anything that you see as a new or acute sudden change with respect to their cognition, their balance, any sudden changes in their vital signs, if you're checking blood pressure at home, things like that, it is always, always worth working up. And I will give you an example. My own father, when he fell and he broke his hip, he had to have a procedure done. And then he was transferred to a subacute rehab facility. And all of a sudden, he was just acting super funny. Like he was yanking out his oxygen. He was so agitated. He was so angry. He wasn't eating. And everybody said, "Oh, that's just the anesthesia. He just, don't worry." And my mother said, "No, I think there's something else going on." And I said, "Let's just take him to the emergency room." And he had acquired COVID while he was in the rehab facility. And that's what was
Oh,
causing his symptoms. So that's just, so never underestimate if you feel that this person, if you have the saying in your head, and CareMobi actually has a feature that you can document this. If you feel that something is off,
yeah.
something doesn't seem right, do not hesitate to call your provider. That's it.
Right.
All you need to, if in that your gut or your head, you're like, something's not right, something is off, that warrants a phone call.
Yeah. Yeah, I love that reminder. I love that reminder. With questions to ask, are there certain questions when we go visit our physician or we're taking our loved one in? Is there some things we could focus on in terms of discovering?
Yes, yes, 100%. So, number one is you want to come in with sort of a list of things to talk
Mhm.
about, right? As this visit is short, it's brief. So come prepared to tell your story and prioritize the issues that are the most problematic. And how do you know what's, I mean, I'm sure there's a million things you could talk about with your doctor, but what are the ones that are really making you miserable and making your loved one miserable, that are compromising their function, their cognition, that are making things hard on a daily basis? Prioritize those. Be specific, and be specific in terms of how long, when did this start? How long has it been going on? Show them photos, show them videos. You can do this all in CareMovie. Oh, look at him. This is how he was walking yesterday, but look at how he's walking now. This is, pictures tell 1,000 words.
They do.
And so, as far as the questions to ask and what to be prepared with, one of the biggest ways you can help your doctor is by knowing your medications. And I know you're going to say to me, Nicole, like they have a list of medications in their chart, but what is in their chart, I can almost 100% guarantee you is not what your loved one is taking.
So true.
Maybe they're not taking it as often as they're supposed to. Maybe they just didn't like it. Maybe they're taking something else. Whatever it is, it's medications are such a key part of it. To the extent that you can have a running list of the medications in CareMobi or any other way and their dosages and know them for a fact, that will help your doctor tremendously. And 80% of emergency department visits, they say, can be avoided by people taking their medications properly. So
Wow.
if you have any questions, how should I be taking it? When should I be taking it? Does
Mhm.
this interact with any of the other medications? How much will this medication cost? Those are all very valid questions. Coming prepared with a list and questions to ask. Your pharmacist is also an incredibly underrated tool and member of your team, your local pharmacist. Try to have all your medications filled at one pharmacy and get to know your pharmacist so they can help advise on what you need. And as you inevitably come up with more questions, they are in your toolbox.
Oh my gosh, yeah.
You always want to get to know, okay, before leaving an appointment, you have to know, if I have a question or a problem, who can I call and how do I get
Mhm.
in touch with them? Never, ever, ever leave a doctor's office without knowing the name of the person you should be reaching out to and the phone number.
Mhm.
Do not expect them to, get a message from you in my chart and like respond immediately. Or maybe that's their preferred way, but ask them, what is your preferred method of communication? How do I reach you? Who do I
Mhm.
talk to? How do I reach you after hours? And is there somebody else in the office, if I can't get to you, that I could talk to?
Right.
Really important. Another key question to ask is, when would you like to see me back? Always, always don't assume that you're going to get a phone call and somebody's going to remember that you were supposed to come back. That's on you,
Mhm.
sadly.
Yeah.
I think the other question is, especially if you have a concern or something is not sitting well, or you've just been told your loved one needs surgery or your loved one needs something major. I always ask my doctors, if this was a member of your own family, what would you do? Would you advise this?
Mm.
Right? Are you doing
Yeah.
this because it's the illegality, because the evidence says you have to do it, or is this really what you view as the right care that this
Right.
person needs at a given
Yeah.
time?
Yeah.
Um, and then, always ask them, is there any more information I can collect for you that would be helpful? And really engage them, work with them, let them know that you are a powerful advocate. You want their job to be easier.
Oh, I love
I'm
that.
sorry to say, but that's the best way to get them to work with you and
Mhm.
recognize that you're a team here.
Yeah.
So come in prepared with questions. Always ask, what do I need any new medications? Do I need any new tests? When would you like to see me again? Who do I call if I have questions? Who do I contact in an emergency? How do I get in touch with them?
Mhm.
Are there any other specialists? Will you be making that appointment, or should I? So much of what what caregivers have to do is around communication, closing gaps, closing
Yeah.
loops. Like, you are a quarterback of your care team, but you are communicator in chief.
Mhm.
And so
Mhm.
understanding how to communicate effectively is really key, and having the information that they need for them is also key. Also, don't be afraid to ask, when will I get my results back? If I don't hear from you into a week, should I call you? Because you really want to keep that pipeline of communication open. And what I find that most caregivers struggle with is that once you leave that office, it feels like the communication has shut down.
Yeah, yeah, totally. Oh my gosh, those are so many great questions. And I love that. It's the communicator in chief.
Yes,
And
totally.
then that's what encompasses what we do. It
Exactly.
does, it does. And I know I've gone into the doctors before and my medication list, I'm like, half of those I haven't taken in like years, and they're still on that sheet.
A- And it's very
Oh.
important to also let them know of any supplements your loved one is taking.
Mm,
Um, the other thing is just if you're taking care of somebody who's living with Alzheimer's disease, or you go in for an initial memory evaluation, don't hesitate to ask about research that's
mm,
going on in the field and whether there's opportunities for you to participate in research or benefit from clinical trials.
mm.
It can be really scary to get diagnosed with some of these issues, but don't feel like this battle is yours alone to fight.
Mhm, mhm, completely. Yeah, it's a village.
It's a village.
A
It's a village.
village. It is. So when you're working with caregivers, what are you seeing as the critical areas where we need more education and training? And is there the ability for healthcare providers to bridge these gaps? Do we go to other resources? What have you found most helpful in in your caregiving?
Yeah, so this is so interesting, right?
Mm,
So much of the training I think we need is around healthcare communication, of self-advocacy, how to ask and how to identify the resources we need.
yeah.
And what's super interesting is that I don't think that that's really a component of medical or nursing education. I really don't,
Mhm.
right? And so you have a diagnosis and we have an evidence-based treatment plan and medications, et cetera, to give you. But the medications have side effects, and these diseases have difficult days, good days, bad days, ups and downs, challenging that the caregiver is living through alongside with this person. And it takes a toll on our health, our physical health, our emotional health.
Mhm.
And I think that a lot of medicine, as I said, when we first started this conversation, we often are living longer, but not better, right? So we have
Mhm.
all these tools to keep people going, but does it maximize their quality of life? And I don't think the healthcare establishment in this country is really saying to themselves, when you come to the office, how am I going to maximize this person's quality of life? No, they're saying, how am I going to treat this illness?
Yeah.
Right. And so we, as the caregivers, are the ones who are, I think, at the end of the day, responsible for putting it all together and actually making sure that the people we love are having a
Mhm.
meaningful and reasonable quality of life. And
Mhm.
so I think some of the symptom management, some of the side effects of medications, the ups and downs, the heart of how do you live life with this disease, that's sort of where formal healthcare stops. And a lot of, as you said, other resources exist.
Yeah.
One of the biggest resources in my own journey, and I'm so happy to admit this and share this,
Mhm.
is when my own father got diagnosed with end stage renal disease and had to go on a form of at home dialysis. One of my best resources was a Facebook group of caregivers of people who were
Mhm.
in the same boat because my father was having terrible, got stomach upset, other symptoms, he wasn't eating. And there was just kind of this throwing up their hands of, we don't know what to tell you, right? But there's sort of all these life hacks that caregivers have come up
Totally.
with, creative solutions when you crowd surf about how to problem solve these issues in
Mhm.
their data, what's worked for them, what's not worked for them. And so I can't underestimate, I don't have time in my life to go to a physical in-person support group, but
Yeah.
these Facebook support groups, these online support groups, they really do truly help me.
Mhm.
Finding peers who are in my own situation. I learned from people, I've learned so much from people who are not in healthcare. I'm not embarrassed to say that. They've taught
Right.
me things. Um, and so I'll give you like an example. My father gets hooked up to a dialysis machine, and so many people complain that the machine beeps at night and wakes them up. And somebody said, "Oh,
Mm.
you should buy this little $10 coil on Amazon that keeps the cord from knotting up." like no, and the dialysis nurse came to see him and goes, "What's that?" And I said, "Oh, it's this great thing that somebody told me." And he's like, "Oh, I'd never seen that before." So,
That's so awesome.
we're constantly, people are innovating, and never doubt the
Mhm.
quality of your own solutions and your life experience. Caremobi's success is because I
Mhm.
know what it's like to be a caregiver. And I also happen to know what it's like to be a nurse practitioner, but more,
Right.
I know what information I'm passing. And so many of we are our best resources.
Mhm.
I think people like Carrie Alberts, our dementia
Mhm.
darling, like I think there's so much good information out there from reliable, trusted sources.
Yeah.
And I think it's our job to make sense of that information,
Mhm.
but I
Mhm.
can't underestimate how much of a role that plays in the day-to-day life hacks, because
Yeah.
people don't go to medical school and nursing school to learn life hacks about how you manage caregiving
Right.
at home.
Oh, it's so true. The creativity I've seen too from people that have come up with these solutions that are so helpful and so practical, right? When we're like, I need a simple change to this one thing I'm trying to overcome. Yeah, it's such a great
Absolutely.
place.
And that was necessity is the mother of invention. When we were dealing with
Mhm.
my father, I was like, how is there no place where she and I can track his vital signs together? How is there no place where she and
Mhm.
I can share what medication he's on? Why am I doing this in a Google Doc that's not even secure?
Right.
And so that was really the impetus of me saying, okay, our family needs to get on the same page about this.
Yeah.
Like
Yeah.
somebody, we all need to know what's going on. That's what responsible care looks like. That's what good care looks like. And that's how you
Mhm.
minimize burnout. And, you buffer some of the really negative ramifications of caregiving. Caregiving is a threat, I think, to our health. And we have to be
Mhm.
super careful in how we approach it and make sure that we are supported.
Right. Yeah. You were talking about the health, and it's so true. The data shows, right, just the emotional and physical distress that, yeah, we undergo as caregivers. And I want you to talk through which we'll get to, like the logistics of CareMobi and how it really comes together so people can get a picture of that. But you had talked about, right, we're living longer, but not better. And when you talk about quality of life, what does that mean? What does that
Yeah.
mean if we're like, we want a quality of life? And I know it does vary for all of us what that actually means, but from your perspective, what have you learned about that?
Right. And so I think so much of it is what brings you joy, and quality of
Mhm.
life for you may be different than for me and for my parents compared to other people's aging parents. And so what is it that brings you satisfaction at this period in your life? And for some people, I'll never forget, I once had a patient who had fairly advanced multiple sclerosis, but his goal was to walk his daughter down the aisle. And so that was
Mhm.
the goal of physical therapy for him, was to just make it enough steps so he could do this one, and to be part of things, and to be, everybody needs a reason to get up in the morning. And
Mhm.
what is it that brings you joy and brings you meaning? And is it being around your grandchildren? Is it traveling to a certain place? Is it, what is it that gives you purpose?
Yeah.
Um, and we plan around that. And I think at different phases in our life, that looks different. And the things
Mhm.
that bring us joy are different. And, we don't have as many needs. So, for my own father, I don't think his goal is to travel around the world. I think his goal would be to go on a cruise with his family. And so, how can we do that? And how do we support that?
Yeah.
And so, there's just little things, and thinking about small but person centered goals and figuring out, okay, how do we make that happen? My goal for
Mhm.
my dad is not for him to run a marathon, but it's, if I know that what brings him the greatest amount of joy is spending time with his grandchildren and seeing them, even if it's only once a week, because that's all he can muster, we make that
Yeah.
happen and we
Happen.
all work towards that. So quality of life is about what brings you purpose, what gives you a reason to get up in the morning. And one
Mhm.
of the reasons that I do a lot of my work clinically in adult day programs, which we often think of as just a bunch of old people doing dancing and dominoes, adult day programs are such a critical lifeline for people because
Mhm.
they're so person centered. They're all about activities that bring people happiness, joy, social connection, and meaning. And
Mhm.
the healthcare system, as I said, is not designed, a hospital is not designed to treat you in a way that brings meaning to your life. They're trying to save your life.
Right.
how we maximize those treatments to really improve our
Mhm.
quality of life, that's a different thing. And that's where the system, we all have to sort of work together, and caregivers are the ones who are really tasked with.
Oh, completely. Yeah. I love that you brought up Adult Day. It is a dear friend of mine. I don't know if you know Chris Channa with
Yes.
Active
Okay.
Age. It's reimagining that such a vital program and option for families. And I think it is now, right, the momentum is moving that we're paying more attention to some of those options. But I know you had some experience. Did some of your research happen with Adult Day? Can you share a
Yes.
little bit about that?
Yes, I will. So I am the biggest advocate of Adult Day. And if I could tell you that in the absence of a cure or treatment, we
Mhm.
have some therapeutics out there for dementia and Alzheimer's disease, but really in the absence of a treatment for any of these sort of problems that are associated with advanced age,
Mhm.
I will say Adult Day is the best therapy and treatment that we have on the market.
Yeah.
And we have research to show that attendance in these programs can slow physical and cognitive decline in people, can in fact reverse it. It improves depressive symptoms, it bolsters nutrition. And, one of the key factors is that it buffers loneliness. And we
Mhm.
know the science shows that loneliness is worse for your health than
Mhm.
smoking cigarettes.
Mhm.
So what these centers do, that simply sending a home health aide to every house, even if we had the resources to do that, that doesn't buffer loneliness the way meaningful friendships do. And
Mhm.
having what I like to call, as a former anthropologist, an extended kinship network. These are
Yeah.
your friends outside your family outside your family. These centers are like microcosms of your neighborhood. They're well set up to maximize your independence in whatever capacity you have to allow that to flourish. The staff are incredibly passionate about what they do, well versed in person-centered strategies. And in this time where nobody wants to go to a nursing home, but everybody wants to stay in their community, there aren't enough, direct care workers to
Mhm.
facilitate that. Caregivers are exhausted. We need respite. We need to be able to go to
Mhm.
work. These programs are going to be a vital lifeline. And the more recognition we can give them and the more funding they have to exist, the more they can do, really, to not only just give caregivers a respite, but to actually meaningfully improve the health and quality of life of the people who attend them. My own grandmother, if you want to know
Mhm.
what the secret to her, the one who's about to turn 100, is she
Yeah.
attended an adult day program for 18 years.
Oh my goodness.
And that was
Wow.
like her second family. And she didn't grow up in this country, but for her, it was a way to integrate and socialize even in later life. And, it's like having a place to go and to share your wisdom and to meet friends and to buffer that loneliness and to work on your exercises and your cognition, and just all of it is
Yeah.
so good for our health.
Yeah, it is. What a testament to how wonderful those organizations are. And, when we look at, right, when we're younger, we're in school, when we're middle aged, we're in a work setting, right? So you naturally have those different dynamics. And when we're older, we have to be purposeful about where we find community.
Correct.
And
You
it's
hit
not,
the nail
yeah,
on the head.
it's so true. It's so true. Uh, are you finding, with healthcare systems, are they open and receptive to platforms like this to be able to share in that communication? Are they seeing it as a let me do my job and I will tell you what to do? How can we work together, right, to have these technologies be adopted well?
Yeah, it's such a good. So it's interesting because with Karamobi, we've like done a pilot test now, at in
Mhm.
rural Tennessee at an amazing adult day center there. And they have found this tool so useful that it's basically going to be a standard of care for anybody who enters their
Wow.
center. We actually had a national news story on the app and its success. And it's really interesting because, of course, as clinicians, you're going to be like, oh, another thing, another portal, another thing I have to log into. But
Mhm.
when these caregivers show up to the visit and they're informed and they're prepared and they can actually present these doctors with correct information, doctors say, wow, this has made my life so much easier. And so we were, in my own father's instance, actually, if you see our news story on this, one of the gentlemen at a center was able to be on fewer blood pressure medications because they were actually getting accurate readings from the day program about what his readings were there. And they were like, you don't need to be on all of this. So it helps with deprescribing. In my own father's case, his blood pressure, we would notice, because I was tracking it all, would spike in the mornings, and then it would get too low in the evenings. And, we had to titrate his medications. And once we did that, oh my God, he was feeling so much better throughout the day, and it was more consistent. So we were able to share these numbers, and they were able to see, these doctors, they can't check your blood pressure 3 times a day. They don't know what's happening. They know what it is in that moment of time when they see you. So the fact that we're able to present them, they express nothing but gratitude that they want this information. It makes their job easier, and it results in better outcomes. And I don't know a single doctor that doesn't want that.
Right, right. Oh, completely. Are you seeing that caregivers are open to overcoming some of those, maybe the resistance to using tech? Are we still, right, obviously educating and sharing? Tell us about their willingness to try those new platforms.
Yeah, it's so interesting. I actually was always thinking that when I created CareMobi, it would skew to a sort of younger demographic. It would be more like sandwich generation caregivers. But it's interesting because we recently ran a survey of our user base to understand, what their needs are. And I was so pleasantly surprised to see that most of our users are actually between the ages of 55 and 70.
Awesome.
So there's really not, the user experience with our app is one of the most consistent points of feedback we get that's
Mm,
positive. It is super easy to use. And we've designed the tool to be more like the apps you use every day and not some complicated, the health and
yeah.
management of the patient is complicated enough. The app shouldn't be complicated.
Right, right.
So we've prioritized ease of use. And I think that the key thing is that there is a total need for this. And I think they realize they're frustrated that they have this information is all over the place. They have no sense of what's going on with their loved ones. And so it's just makes communication that much easier, and it does support better healthcare.
Yeah.
So we have found that actually, on average, our users were older than I would have anticipated.
Yeah.
But again, you as an innovator and a problem solver, you also
Mhm.
not only have to think about the problems of today, but you have to think about what things are going to be like 10 years from now, 15 years
Right.
from now. We use our phones for everything.
Mhm.
So why is our healthcare not centralized in some way?
So true. It's so true. Is this is this something that we should look at from like at a policy level, right? Or if we're looking long term and we want to make change, or is our system so fragmented that there isn't going to be that universal way of how we do things? I don't know. Does that make sense?
Yeah, no, I feel like there should be a catch-all. All these systems should talk to each other. And should
Yeah.
there be a policy that focuses on this? And I think there have
Right.
been a lot of executive orders around this and focuses on
Mhm.
bridging and you sort of creating and facilitating interoperability between systems. And I think it's
Mhm.
all wonderful. But one thing that I've just felt for a really long time is that if Doctor One's electronic record talks to Doctor Two's electronic record, that's wonderful. That's great. But that still doesn't tell Doctor One or Doctor Two what happens in the other time that this person has not been in the
Mm,
doctor's office.
mhm,
And
mhm,
that's where I see the missing piece. And so, yes, I think there's a call out there for caregivers to get more training and education and resources. But at the same time, I'm conflicted about how I feel about that from a policy standpoint, because I
mhm.
think caregivers also need help. Like, I want
Yeah.
to spend my father's like final time with him talking about things we enjoy and things we love, which fortunately both for us happens to be healthcare. So we complain about that a lot. But I don't want it to be about fighting with insurance companies and fighting to get a pre-authorization and calling, all of that work that we saddle family members with
Mhm.
takes away from meaningful and quality time with our loved ones. So while I'm all about training and education and improved advocacy, I
Mhm.
also just think policies need to be oriented towards actually getting resources in the home and in the community.
Yeah.
Adult daycare should be free and available for anybody who needs it,
Right. Right.
right? Those are the types of policies that we need to
I
see.
love that. Yeah. No, that is such a good point. And there's, I believe I either read an article or watched you talk about how we're used to communicating with the caregiver with our children, right? Like you were saying in pediatrics, but there hasn't always been the focus to educate about caregivers with older adults. And is that, to your point, right, an extension of how do we set up that mindset? And also include them in that decision making like we would when we are advocating for our children.
Yeah, so it's interesting with children. I think there's such a clear delineation of roles. I'm the
Mm,
parent. This is my child. I'm
yeah,
responsible for overseeing their health care and well-being.
right.
With older adults, it's sort of like there's going to be a period of role reversal and role loss where these
Mhm,
people went from being to your parents to who,
mhm,
to now being dependent on you for care and support.
mhm,
So it's not such a natural transition. It happens at different times for everybody else. And we often like to bury our head in the sand about aging. Um, and so it's a tricky situation.
mhm,
And I, it's quite it's just a very challenging from a social perspective and psychological perspective about how we view these things. So, I think the key point of all of this is that we all want optimal and better healthcare for the people we love. This is exhausting. It's tiring. None of us, no matter how many degrees we have, are trained or well set up to do this.
yeah.
But there are tools that we can use. And, CareMobi is a freely available app that helps families get on the same page about their health. The best thing we can do is get organized, be prepared with the data we need to advocate for those people we love. And secondly, the other thing is that I know it's not enough to give people an app. Some of the questions you've asked me today are amazing. What questions do we ask at the doctor's office? What should we always know? And so, for more information about that, you can definitely follow us at Enlightened Caregiver on Instagram. Enlightened Caregiver is really a community for people to understand how we advocate more effectively, how we know when our parents need more help, where do we put them, all this information that we need to make better decisions
Mhm.
is available there, and we're continually adding. So we love to have more and more people join our community so that we can be responsive to the needs of everybody.
Absolutely. And we'll direct people where to go. Thank you for sharing. We could talk for so much longer. And I know I'm just excited about people will be knowledgeable and empowered advocates. And thank you. Thank you for your
Thank
work.
you so much.
It's
I
so
really
wonderful to
appreciate
meet
you having
you.
me.
Are you looking for more support and community? We sure are. That is why I'm so happy to highlight one of my favorite podcasts in the caregiving community, Confessions of a Reluctant Caregiver, hosted by my friends and sisters Natalie Elliott Handy and JJ Elliott Hill. They offer a unique blend of personal storytelling, expert advice, and candid conversations that shed light on the real life challenges and triumphs that caregivers face. Tune in to Confessions of a Reluctant Caregiver wherever you enjoy your podcasts or explore more on their website at www.confessionsofareluctantcaregiver.com. Thank you for listening today. If you enjoyed our episode, please subscribe and give us 5 stars. In all honesty, we'd love to hear from you. Thank you so much for listening to our episode.